Hi everyone. In this video, I'll be discussing antiviral drugs. Now, most of the viral infections are difficult to treat, but there are certain viruses which we can treat. For example, influenza, hepatitis B, hepatitis C, herpes virus, and COVID-19. We have another virus, hepatitis B, we discussed. There is one more virus that is HIV. So, HIV, we will have a separate discussion. We have a separate video for that, and that is called antiretroviral drugs. We'll discuss it separately. What about the other virus? For example, if there is dog bite, patient may get rabies. Can we treat rabies? No, we can only prevent it. Suppose there is mumps, measles, rubella. So we have no antiviral drugs for them. Only thing is we can prevent it by giving vaccines, right? And if the viral infection occurs, it's only symptomatic therapies. But only for few virus we have the infection. So let us see what are the viral infections we can treat. So let me write what are the viral infections we are going to discuss now. The influenza virus, then the herpes virus, then hepatitis. We have the hepatitis B and C virus, then the COVID-19, coronavirus disease, which started in 2019, and another is HIV. So we'll discuss that HIV in a separate video. Right now we'll be discussing influenza, herpes, hepatitis, and COVID-19 drugs. We'll start our journey. The first one is the drugs. They are called as anti-influenza drugs. So anti-influenza drugs. So we also faced the pandemic of influenza, not now, very long ago. So right now we also get the cases of influenza. The older drugs which were used for managing influenza, the name is called amantadine, and one more drug by the name rimantadine. Now these are older drugs in the management of influenza, but not used nowadays. But the questions may come, what is the mechanism of action? It inhibits a protein in the virus called M2 protein. It inhibits a protein in the virus called MT protein. Second, it inhibits the viral uncoating. Sir, what do you mean by inhibiting viral uncoating? Now let me write, this is the cell, and the virus infects the cell. So the virus has to infect the cell. So when the virus enters, so this is the virus, and it has the DNA or RNA depending on the virus. When it enters inside, it has to remove the coat and the genetic material is released. So this is called uncoating. This step is blocked by the drugs amantadine and rimantadine. Now where to use them? These are used in only influenza A only. They are not effective for B. They are only used for influenza A only. I think most of you heard of amantadine already somewhere. Where? It is also used for one more disease in CNS. Can you guess? Yes, it is Parkinson's disease. Amantadine, rimantadine, these are used for influenza A in case of the viral infection. Now one more group of drugs which are the anti-influenza drugs, very, very important. These are called neuraminidase inhibitors. Now, what is the role of neuraminidase? I told you, when the virus is inside the cell, the virus has to exit after the new virus is formed. So this is the infected cell. This is the infected cell with the virus. So once the new virus is there, it has to exit. So the exit is mainly done by neuraminidase. So if you inhibit the enzyme, the virus cannot exit outside. So the exit of virus is inhibited by these drugs called neuraminidase inhibitors. What is the name of that? The name is called oseltamivir. It is called as oseltamivir. Remember, oseltamivir, as the name starts with O, it is given oral. It's an oral drug. Now, this drug is used for both treatment. Remember, it is used for both treatment as well as prophylaxis of influenza. Treatment as well as prophylaxis. What do you mean by treatment? If the patient is already having influenza, give the drug. If he is exposed or he wants prophylaxis, also then you can give the drug. And it is mainly used for the influenza A as well as B variant. It is also used in the H5N1 variant or the H1N1 variant of influenza. So all these cases we can use oseltamivir. Apart from oseltamivir, do we have any other? Yes, we have a drug called peramivir. It is called peramivir. Peramivir, remember, it starts with P and it is given parenteral drug. The name is peramivir. One more drug is zanamivir. Sir, why you have made the word capital N? To make you understand, zanamivir is given nasal, intranasal route. It is given by intranasal route, and that is zanamivir. So these are the important drugs for influenza, and most of your exam question is, what is the mechanism of action of oseltamivir? Remember again, it is a neuraminidase inhibitor, repeatedly asked in exam. Please make a point of this. Write down. This is very, very important. Now, another drug has been recently approved for the influenza. It is known to inhibit. The drug inhibits an enzyme called polymerase acidic endonuclease. So this drug inhibits polymerase acidic endonuclease. So what happens if you inhibit that? This will inhibit the viral replication. The drug will inhibit viral replication. So what's the drug I am talking about? The new drug for influenza, it is called as Balo. Starts with Balo. Baloxavir. Baloxavir is a new drug for influenza. So currently there are three important things for influenza: amantadine, nimantadine, then oseltamivir, and then baloxavir. So most important point you need to keep in your mind is the neuraminidase inhibitor oseltamivir. Very good. The next group of drugs are called anti-herpetic drugs. So these are used for managing the herpes virus. So mainly we have herpes virus 1, herpes virus 2, and the varicella zoster virus, which is known for chickenpox. Then we have the cytomegalovirus and the Epstein-Barr virus. So for Epstein-Barr virus, we don't have any treatment. Whatever treatment we have is for these four: herpes 1 and 2, varicella zoster, and cytomegalovirus. Now what is the treatment aspect we have? Now let me write that. The drug name is acyclovir. The drug name is acyclovir. Now what is the mechanism of action of acyclovir? Very, very important. Let us understand that. Now this herpes virus will infect the cells. So the drug should go to the infected cells of humans and inhibit the virus. So how does it do? Let us understand this. Let me draw the infected cell. This is the infected cell. Let me extend it further. Yes. Now, what happens when we give acyclovir? Please remember, acyclovir is a guanosine analog. So we are using a fake one. You know that the DNA synthesis requires purine and pyrimidine, and we are using a fake one. So when acyclovir is taken up by the infected cells, acyclovir is converted into acyclovir monophosphate. And this conversion is done by something called virus specific. They are called virus specific thymidine kinase. They are called as virus specific thymidine kinase. And what is the importance of this? The importance is acyclovir will become active only in the virus infected cells. So the normal cells are rescued. Our human cells are rescued, but the human cells infected with the virus are going to be affected by acyclovir. So there it will work. But normal cells non-infected with herpes, they don't get affected. So that's why it is called virus specific thymidine kinase. Then this will become again acyclovir diphosphate. Again it becomes acyclovir triphosphate. And this conversion is done by the cellular kinase which is present inside the cell. Now it's like a fake nucleoside which we are given. Now what happens? This fake nucleoside will go and sit in the DNA synthesis place. So when it sits, the DNA synthesis will not progress. So there is inhibition of DNA synthesis. So along with that, they also inhibit the enzyme DNA polymerase. So this is the mechanism of acyclovir, why it will only affect the infected cells. Because normal non-infected cells don't have this virus-specific thymidine kinase, so they are not affected. Now, remember, acyclovir is only going to work on the herpes virus as well as varicella zoster virus. It is not going to work on cytomegalovirus because it is intrinsically resistant. That means naturally resistant. For that, what need to give is a drug by the name ganciclovir. The name is called ganciclovir. Again, this is a guanosine derivative, and it is also activated by virus-specific thymidine kinase. And what you get is the ganciclovir monophosphate. Again, from that you get ganciclovir diphosphate. Again, you get from that ganciclovir triphosphate by the cellular kinase. The cellular kinase will do that. So to activate ganciclovir also, we require the same enzyme, virus-specific thymidine kinase. We all know that. So by doing that, it also inhibits the DNA polymerase as well as DNA synthesis. Now there is a trick here. What is the trick here? Now we think we are intelligent, but viruses are also intelligent. So what they do, they will mutate this virus-specific thymidine kinase. Now if that enzyme is not working, if it is mutated, it will not work. So that is called the resistance problem. Suppose there is a mutation of this virus, the enzyme is mutated, then if I give acyclovir cannot kill herpes, it cannot kill varicella zoster, and ganciclovir cannot kill cytomegalovirus. Then the resistance problem. So we had to come with some new drug for that. So if they are resistant to this, there is one more new drug, and the name is called foscarnet. Now foscarnet specialty is it doesn't require activation like this. It can directly come and inhibit the DNA polymerase without activation. So even this virus is mutated, foscarnet can be used. So that's why if there is acyclovir resistant herpes or varicella zoster, the drug of choice is foscarnet. If there is ganciclovir resistant cytomegalovirus, the drug of choice is foscarnet, because even the enzyme is mutated, it can inhibit the enzyme, that is DNA polymerase, without becoming active. That's the specialty. Now, once we understand this, these acyclovir and ganciclovir are very short acting. So what we do is we have to give them as prodrugs. For example, we have val acyclovir. It has better pharmacokinetic profile and longer acting. So after metabolism, it will become this. So it's a prodrug. Again, ganciclovir, we have val ganciclovir. Again, it's a prodrug, and it becomes active into ganciclovir. So this is how the activation occurs. So let us discuss one by one. I hope you understood the concept behind the resistance and how we manage this. Clear. Let us take up acyclovir, a very commonly used drug for herpes. Acyclovir. Now acyclovir is given minimum 5 times a day. but valsiclovir is given 3 times a day. Now, acyclovir is the drug of choice for herpes simplex 1, herpes simplex 2, as well as varicella zoster virus. Now, if they become resistant, then the drug of choice will be, yes, what is the name? Come on. It is called as foscarnet. Foscarnet. Is there any adverse effect of the drug? Yes, the adverse effect of the drug is this is nephrotoxic. Now, when I tell the drug is nephrotoxic, what is the point they can ask in the exam? Should we reduce the dose of renal failure? Obviously, yes. That is the first drug. The second drug is ganciclovir. The name is ganciclovir, and it is the drug of choice for cytomegalovirus, CMV. If there is resistance to that ganciclovir, then what is the drug of choice? Very good. It is same foscarnet. The name is foscarnet. Now, what is the adverse effect with ganciclovir? Any problem? Please remember, the drug is also nephrotoxic. And most important is bone marrow suppression. So, bone marrow suppression is the major drawback of this drug, ganciclovir. And remember, when you are using this drug, monitor the creatinine. So, creatinine can rise, serum creatinine can increase when you are using ganciclovir. Very, very important. You may ask a question, sir, can we use ganciclovir in the management of herpes 1, herpes 2, varicella zoster? You can use it, but it is not approved. Because we don't want ganciclovir to become resistant if you use for this herpes. So we want to reserve this for only cytomegalovirus. Correct? Yes. Now the third important drug, foscarnet. Now foscarnet is the drug of choice for what condition? You know that acyclovir resistant cases and ganciclovir resistant cases. So we use it in resistant cases. Let me repeat here. Foscarnet is a drug of choice for acyclovir resistant herpes 1, herpes 2, as well as varicella zoster virus, also for ganciclovir resistant cytomegalovirus. But one of the problem of the drug is, again, the drug is nephrotoxic, very, very important. So you have to monitor the renal function test, and the drug causes electrolyte abnormality. So you have to monitor the electrolytes also when you are infusing this, when you are giving this, because it can decrease the divalent, mainly the calcium and magnesium ions are decreased mainly. So the monitoring has to be done because of electrolyte abnormalities. You have to monitor. This is foscarnet. So foscarnet, ganciclovir, acyclovir, these are the major drugs what you need to understand. Now let me do one more thing. Are there any other drug for herpes? Do we have any other drug? Yes. Now what we'll do is we'll write here herpes 1, herpes 2, and varicella zoster virus, and here we'll write cytomegalovirus. Now for all this, we know that the drug of choice is acyclovir, and for cytomegalovirus it is ganciclovir. If they are resistant to these, the treatment will be foscarnet. I know I am repeating this, but you have to register these things. Now what we'll do is we will divide this with a line. What are the other drugs apart from acyclovir we have for treatment of this? The other drugs are the name famciclovir. The name is famciclovir. Okay. The name is famciclovir. So famciclovir is a prodrug. The mechanism is similar to acyclovir. Whatever we wrote for acyclovir, same thing, it gets activated and then inhibit DNA polymerase and DNA synthesis. So inside the body, it is converted into penciclovir. These are also used for herpes. Apart from that, what are the other drugs used for herpes? We have dacosanal. So dacosanal is used, it inhibits the virus entry. It inhibits the virus entry and it is used for topically. Where do you use it? Topically for mainly herpes labialis. Herpes labialis. Herpes labialis. Then we have another drug. They are called idoxuridine. And one more is trifluridine. These are used for herpes keratitis. They are mainly used as topical as eye drops for herpes keratitis. So they have the same mechanism of action like acyclovir. They inhibit the DNA synthesis. But only special is dacosanal, which inhibits the virus entry. So these are all for the herpes and varicella zoster. What about the cytomegalovirus? Cytomegalovirus, we have ganciclovir, we have foscarnet. Is there any other option? Yes, we have other option for this. The other drug is called cidofovir. The name is cidofovir and it is only used for CMV resistant cases. So cytomegalovirus resistant cases it is used. But the drug of choice for that is foscarnet. So it is used for, cidofovir is used for resistant case of CMV. And one more drug is called, the name is called fomiversen. The name is called fomiversen. It is an antisense oligonucleotide. It is an antisense oligonucleotide. The name is called fomiversen. So they will not allow the RNA to express, they will silence them and thereby they inhibit the viral replication. So the antisense oligonucleotide is fomiversen. Where do you use it? It is used in MDR, multi-drug resistant cytomegalovirus infection, CMV infections. So multi-drug resistant cytomegalovirus infection will use fomiversen. Okay, it is called fomiversen. Again, we have cidofovir. But remember, for these two conditions, I have bifurcated so that it's easier for you to understand the things. What is for herpes and what is for cytomegalovirus. Right. So once we are done with the herpes, it's important that we discuss the treatment for hepatitis B. Hepatitis B. Now, when you treat hepatitis B, should we use combination therapy? Most important, when you treat hepatitis, it is a single drug therapy. It's a single drug therapy. It's not a combination therapy. Please keep that in your mind. Now, should we continue lifelong? Yes. But only thing is, only if the viral replication is going up, then we use the drug. When it suppresses, we stop the drug. So intermittently it is given. And let us write what are the drugs for this. The drugs are entecavir. The name is entecavir. Then we have adifovir. It is called as adifovir. And one more is called telbuvidin. So remember them as the drugs, E drugs, entecavir, adifovir, and telbuvidin. Now all these drugs, what is the mechanism of action? They all inhibit DNA polymerase. So they all inhibit DNA polymerase. That is the mechanism. Now there are other drugs which are useful for HIV as well as hepatitis B. What are these drugs called? The name is tenofovir. Then we have emtricitabine. And one more is lamivudine. Lamivudine. If you know the eat, then if you have eaten, tell me. Tenofovir, emtricitabine, and lamivudine. Tenofovir is available in two formulations. One is called the disoproxil. It is called as disoproxil fumarate. And one more is called alafenamide. Alafenamide. Sir, when do you prefer this? Now, they have done studies where disoproxil fumarate is better in pregnant women. Suppose pregnant woman is hepatitis virus positive and she has to be given treatment, then we prefer giving tenofovir. Disoproxil fumarate is preferred in hepatitis B positive pregnant women. Sir, we understood, but what is the drug of choice for hepatitis B? The drug of choice for hepatitis B virus infection is either you can give the entecavir or you can use tenofovir. Not the combination. Remember, it's a single drug therapy. Either you can use entecavir or tenofovir, not both. Either of them can be used. Right? And they can also ask you what are the drugs used in hepatitis B, also useful in HIV, tenofovir, emtricitabine, and lamivudine. These are the points about hepatitis B. Then another important virus is hepatitis C. Hepatitis C virus. Hepatitis C virus, the earlier therapy for hepatitis C was interferon alpha. Interferon alpha. And one more drug for hepatitis C earlier was ribavirin. It is called ribavirin. And the mechanism of action of ribavirin is to inhibit RNA dependent RNA polymerase. So it inhibits RNA dependent RNA polymerase. So that is used for this, that is hepatitis C. Apart from hepatitis C, do we use ribavirin anywhere else? It is also used for one more infection, that is RSV, respiratory syncytial virus infection. Sir, is there any prophylaxis for this? Yes, we have a monoclonal antibody and that is called palivizumab. Now you read the name, MAB for monoclonal antibody, VI stands for virus. So it is the drug approved for prophylaxis of RSV, respiratory syncytial virus. The name is palivizumab. Again, this was the question appeared recently. So for hepatitis C, we have two drugs, interferon alpha and ribavirin. These are older drugs. Nowadays, we have come up with a third category of drugs. They are called, the next category of drug for hepatitis C are direct acting drugs. So in that we have NS5A inhibitors. So remember 5A inhibitors. Since they end with A, the drugs also end with ASVERs. So no need to mug up all the drugs. Remember the end, that is ASVER. Then we have NS5B inhibitors. NS5B inhibitors. And they all end with Bovirs. They all end with Bovir. NS5B is also called as RNA polymerase. So RNA polymerase inhibitors. Just remember they end with Bovir. Then we have another category. They are NS3/4A inhibitor. And that is also called as protease. So they end with protease inhibitors. They are also called as protease inhibitors. And the protease inhibitors, they end with Previr. So you know protease, Previr. Now if you have this clue, there is no need to mug up lot of drugs. There is no need to mug up. So once you have the basics like this, I will be writing the ASVIR drugs, and just for your information. Otherwise in the exam, if you just see this ASVIR in the end, they are NS5 inhibitor. Example is Dacla, Tasvir. Then we have Ledi, Tasvir. Then we have Lamivudine. Then we have Tenofovir. Then we have Ribavirin. Then we have Entecavir. Then we have Tenofovir. Then we have Ribavirin. Then we have Entecavir. 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 Then we have Pasver, Ledipasver, then Ombitasver. So I know this will put a burden on you, but if you know that they end with Asver, no burden. Then the BB inhibitor, that is 5B inhibitor, they end with Buvir. The name is Sophos Buvir. Then Dasa Buvir. Then Delio Buvir. So again simple, they all end with Buvir. Then protease inhibitors, I told you, they will end with Previr. Example is Bose Previr. Bose Previr. Then Sime Previr. Then Parita Previr. So Previr. So I have just summarized the things here. So should we buy at all these things? No need. I have given the clue. 5A inhibitor, Asvir. 5B, Buvir. Protease inhibitor, Previrs. Very good. Sir, in managing hepatitis C, should we use a single drug or combination therapy? 100% in managing hepatitis C virus infection, you have to give the combination therapy. Very much important. Combination therapy should be given. So we choose the drugs from various classes, what I discussed. I will give one regimen. Sofosbuvir plus Daclataxel plus or minus the old drug Ribavirin. Usually the duration of treatment will be for 3 to 6 months. Now this regimen has given 99% cure rate. So we have best drugs for now to treat hepatitis C virus. Okay. So hepatitis B is a single drug, hepatitis C is a combination drugs. Okay. Now moving on to the most important virus, and the virus which made us to sit at home for 2 years, not us as a doctor, the coronavirus disease 2019, which originated from the Wuhan, that is China. And already we had this coronavirus which had caused the SARS and MERS, but it has mutated now and come as a new variant. That's why it is called novel coronavirus. Now, there are certain drugs which we used in the management of COVID-19. When the COVID-19 started, we used various drugs. We used ivermectin, azithromycin, HCQ, multivitamin tablets, right? So doxycycline. We used multiple things. But penultimately, the drugs which saved the life of the patient of COVID-19 who was in severe COVID are steroids. So in COVID-19, remember the drugs which decreased mortality, that is death rates in COVID-19, they are steroids. Now, another problem in COVID-19 was the formation of clots. So when there was formation of clots, the patients were given low molecular weight heparin, or they were given the Novax. So what are the Novax? Novel oral anticoagulant, that is, either they were given the drug dabigatran as prophylaxis, or they are given the drug sending with apixaban, rivaroxaban, like that. So that is prophylaxis. Another complication that happened during COVID-19 in the second wave is cytokine storm syndrome. So for that, what we used is number one, steroids. We use steroids. Now another important thing is tocilizumab. So recently that asked the mechanism of action of tocilizumab. Tocilizumab is an interleukin 6 antagonist. It's an interleukin 6 antagonist. Apart from that, did we use any antiviral drug during pandemic? Yes, we used a drug by the name remdesivir. The name is remdesivir, as the name starts with R. Remember the mechanism of action, it inhibits RNA-dependent RNA polymerase. RNA-dependent RNA polymerase. Now don't confuse this drug with rifampicin. Rifampicin also inhibits, but it inhibits DNA-dependent RNA polymerase. This is RNA-dependent RNA polymerase, and remdesivir is given intravenous. Now, remdesivir is approved by US FDA, but other countries are not still approving this. So, because it was approved for Ebola and pandemic, we didn't have any other alternative, then we started using remdesivir. So, they had asked the mechanism of action of this. It inhibits RNA-dependent RNA polymerase. Now, what are the new drugs which have appeared for the COVID-19? Are there any new drugs? Are there any new drugs for this? Very important point. Now, we know that the spike protein is the one which provides attachment and a virus enters to the cell. So, the drugs which target the spike proteins. So, if you block the spike proteins, you can prevent them infecting newer cells. So, what are the drugs which targeted this? The name are, they are monoclonal antibodies. Examples are Casirivimab. So, you know Siri plus Iamdevimab, Iamdevimab. So, Imdevimab. That is one option. The another option what we have is the Bamlanivimab. So, जब भी कोरोना वायरस होता है तो बम को लाना तो वायरस को उड़ाएंगे तो Bamlanivimab. Along with that, we used something called Atezolizumab. And Sotrovimab, and one more is Bebtelovimab. So these are the drugs which target the spike protein and they prevent the corona from infecting new cells. So these are approved mainly for mild to moderate COVID-19. Mild to moderate cases of COVID-19 which doesn't require hospitalization, there it is approved. So that is the targeting of spike protein. The next one drug which inhibits the protease, so it is called as the protease inhibitor. What is the name of this protease inhibitor? Anybody? The drug name has Nirma. So when you have virus, you can wash the virus with washing powder Nirma. It is called Nirma Trelvir. So it is called Nirma Trelvir. It is used along with ritonavir. This, and again the virus which is targeting, the drug targets protease. Again, it is approved for mild to moderate case only. That is protease inhibitor. There was one more drug by the name Molnupiravir. Molnupiravir was causing viral mutations and inhibit viral application, but that is not used nowadays. It is discontinued. So I am not discussing that. Now, recently in one of the exams they asked, when the COVID-19 happened, there was lung fibrosis. So is there any drug which prevent that lung fibrosis? Yes. Pulmonary fibrosis due to COVID-19. Is there any drug to prevent that? Prevention. So recently in one of the exams they asked this question. What is the name of this? It is called Pirfenidone. Pirfenidone is an anti-fibrotic agent. It's an anti-fibrotic agent. One more that is tried for that is 90-danib. So since it ends with nib, it's a tyrosine kinase inhibitor. And it is actually used for treating idiopathic pulmonary fibrosis. Idiopathic pulmonary fibrosis. So these are the drugs which were used to prevent the complication of fibrosis. Okay, Pirfenidone and 90-danib, and the other drugs are protease inhibitor, target of spike protein, remdesivir. How do you manage cytokine storm? These are the most important things what you need to remember for an exam point of view. Okay, so that is about the antiviral drug. I told you when we are managing virus, it's important that most of the virus we cannot treat properly. There are only few viruses. Influenza, the main drug you have to remember is oseltamivir. it inhibits neuraminidase. Very important. It is a drug of choice for treatment and prophylaxis of influenza A, B, H1N1, H5N1. Drug of choice for herpes 1 and herpes 2 is acyclovir. Even for varicella zoster, it is acyclovir. If it is resistant, foscarnet. Cytomegalovirus, drug of choice is ganciclovir. If it is resistant, foscarnet is the drug of choice. All the three drugs are nephrotoxic. Who causes bone marrow suppression? Ganciclovir. When you're using foscarnet, you have to monitor the electrolytes and GFR. Very much important. Then moving on to the hepatitis B, what is the drug of choice? It's entecavir or tenofovir, any of this. It's a single drug regimen. Coming to hepatitis C, we use the combination of drugs. The one which inhibits 5A, they are called Asvir. 5B, they are called Buvir. And protease inhibitors, they end with Previr. So we use the combination of drugs and the regimen is for 3 to 6 months. COVID-19, we target a spike protein, we inhibit a protease, and we prevent the fibrosis. And the only drug we decrease the mortality in COVID-19 are steroids. Cytochrome, we also used interleukin 6 antagonist that is called tocilizumab. And to prevent clot, we used low molecular weight heparin and Novax for that. So that is about antiviral drug. Thank you all.